Oh, wasn't expecting that to happen. What? Bizarre back births, chicken wings where they shouldn't be, and of course, don't pull it out. Today, we're breaking down and reacting to the most jaw-dropping medical scenes from The Substance. Let's dive right in. Oh, gnarly. Pretty good depiction. Even with the seatbelt, you get jostled around, and that's why patients come in. They still feel like sore neck, body aches, because as you get thrown around in a car accident, your body's doing everything it can to protect yourself from flying around.
One moment.
It's so funny. This stethoscope is like a chintzy, not very good stethoscope. It's almost like the ones we use to throw out if we have a patient harboring some sort of bad pathogen. It's not very good. You can't really hear much with this.
Is there a problem?
No, it's perfect. You're a good candidate.
Very intricately feeling the spinous processes of the spine here. Don't know if they're feeling just from an anatomy standpoint, they're feeling for area to inject, but this is the thoracic area. I don't know what this is. The activator almost looks like the normal scissors that we have in like a suture kit. Having an injection, could be placing an IV versus just injecting into a vessel. We're seeing this yellow fluid. The only real yellow stuff that we see in the emergency department that we inject into people is TPN, which is basically total parental nutrition, which is basically like a banana bag, but it has vitamins in it. That's why it has that color. Using a tourniquet, so we use a tourniquet in the hospital to plump up the veins so you kind of keep the blood in that area. So you do it on the bicep to keep the venous blood in, so it dilates them up a little bit so it's easier to access, and then you actually release it once you access the area. Oh, that's not good. The fall to the ground right on the jaw, on the tile floor, can fracture a jaw, break your teeth, lose your teeth, cause intracranial bleeding. Just a fall from that height without protecting yourself can cause significant trauma. When somebody comes to the emergency department, we're gonna get a CT scan of their head, neck, and face. Whoa, what is happening here in the back? If you saw a back doing that, that's muscle fasciculation, that's muscle movements. Sometimes we'll see fasciculations after we give medications for RSI, so rapid sequence intubation, you're giving a sedative, but you're also giving paralytic, so different things happen to the muscles. I changed it. What the heck? No way. Never seen this. That's crazy. Your pupil doesn't split off like that. Come on.
Come on!
You only have one pupil. Your eye couldn't do this. You could have injuries around the iris and the pupil itself, which could not have the pupil perfectly round. It shows that you maybe have had like previous surgery, but you wouldn't have two. It would all be connected. Oh, wasn't expecting that to happen. What? This actually happens post-surgical things. When somebody has a wound that opens up, we call it wound dehiscence. The wound edges will look like this. They're not actually bleeding. The edges of the skin and the subcutaneous tissue did not take to each other. The wound will heal from the inside out. You just have to keep the edges clean, the wound clean. You can't just go back and resuture it shut. What the? Is it like another version of her? Oh, people vomit a lot and come to the emergency department for vomit, and they tell me it's green or yellow. When you do have that type of vomitus, in general, that is your bile. What's stored in your gallbladder, it's very bitter. People get really grossed out by it. Not dangerous, nothing to worry about. It just means you vomited a lot. Oh, sewing back together. Sewing back together, as I just discussed, the likelihood of a wound that dehisces like this won't go back together. And then we're using a big suture here, probably like a 0. And the material itself, you can see it's like fraying. It almost looks like rope versus like a nylon. You don't want something this massive because it's going to leave massive holes and scars where you leave the suture material. In areas where your skin is thicker, like the back here, and there's more potential tension on it, you might need a thicker material, but you don't necessarily need this massive and large. Food tray. They're doing this the IV sideways. All the nurses out there or people put IV lines in, you know you don't put it that way in. And of course, not to mention it's not sterile, no gloves, and the skin wasn't prepped. Whoa. Whoa. Anybody have that like high-pitched noise that just doesn't go away? That's tinnitus. Sometimes you get it, it comes for a couple seconds and then goes away, but some people get it all the time. Try not to get any ear damage from listening to too loud of music out there. Holy shnikes, that is a big needle. It's got markers on it. It has an introducer to it. You can see that there's the small green cap versus the big massive cap that looks like a Lego. That piece comes out typically because that's an introducer to allow the catheter to stay. Okay. Nice. Needles that I've seen that big that we use in the emergency department are spinal needles. We'll use a needle about that long, typically 3 inches for spinal taps or a lumbar puncture. But our job is to actually use the smallest gauge needle that we can use to access the area. Oh my gosh, that's a lot of CSF. I'm assuming they're pulling out CSF. CSF, cerebral spinal fluid. Usually you're just taking a couple mLs, not taking out 10 mLs. Oh, what the heck? The BBL gone wrong. What is that? What? So you normally can't stick your fingers in your belly button and get going onto the inside. Yes, there's not that much material from your belly button to the inside. That's where our umbilical cord used to be to give us nutrients into our bodies. But no, you can't do this.
This.
That literally looks like an uncooked chicken leg. That's gross. Oh, it really does look like a cooked piece of chicken. What is this? Bleh, what was that? What is this? Your belly button doesn't look like that. It looks more like your butthole. No, we've got it wrong. Oh, doing CPR.
Lovable part of me, you have to come back. You have to come back. Come back.
Okay, not the best CPR, but you can do CPR while on a patient like that. There are times in the hospital where somebody might be transported on a gurney that instead of doing it on the side, a hospital staff member will actually jump on top of the bed and actually do CPR in this position.
Come on.
Oh. Wow, gross. Trying to get blood into the body here. You can do this. I've never seen it done before. And again, you got to be careful because of the tubing. You have air within the tubing that you're potentially getting into the body. Oh. Falling on the ground like this would increase the likelihood of a skull fracture and intracranial bleeding, especially in somebody who's quite frail. You'd think somebody who's frail like this, typically the brain would end up shrinking a little bit, which then increases the risk of the brain jostling around within the skull itself. Woo. You can see the classic spidering pattern of a skull hitting glass. So you see this in this type of injury, but you see it a lot with car accidents as well. We always ask EMS to tell us if they've seen something like that when it comes to a car accident. Cool dress. Uh-oh, falling apart, tooth coming out. Another tooth. Don't. Oh gosh, that's why I'm not a dentist. Not a dentist, pulling your own tooth out. Yeah, not cool.
It's not cool.
What you would end up doing is shoving this right back into the socket and splinting it in place. So you're gonna splint it with your other teeth. Boy. Don't just pull them out, put those back in. Sometimes the teeth can fall out due to trauma. You can have gums that are receding. Also, if the bone is destroyed where the tooth is attached, or if you're having chronic changes to the bacterial environment of your mouth, increase the risk of potential tooth decay. Oh, the nail. Oh, don't pull the nail. So, okay, people will injure their nails sometimes. That is totally normal. stuff happens. Don't pull the nail out. The nail itself is the best splint that we have. If you don't, then we have to use some synthetic material, literally like a piece of foil. Oh my gosh. Is she being reborn? Oh, we got the yellow vomit. What the heck? It is a real-life teratoma. A teratoma is a type of tumor that has all undifferentiated type tissue in it, which typically is like hair and teeth and nails. This looks like a placenta, but the vasculature is huge. It doesn't normally look like this. The placenta itself, lots of different blood vessels, kind of all over the place, something like mashed up together, but it's really important for the development of a baby. Whoa, freaky. I don't know what's in that injection, but I do know the best anti-aging serum isn't some sci-fi substance like this. One of the best things that you can do for your body is sleep. That's why I formulated Do Not Disturb from Life Happens to help you fall asleep fast. Check it out at lifehappens.com or on Amazon. Yeah, no joke. What would you do if you ever saw that in real life?
That's gonna kill me. That's real.
I don't think you just scream and call out people like that. Help them. Get them help. A lot of fluid that's getting sprayed around at everybody, increasing the risk of bloodborne pathogens, HIV, hepatitis. I don't know what that's supposed to mean. This is crazy. This was intense. If you enjoyed my reaction to this, definitely check out this playlist right here. And do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.